Hi everyone, my name is Ashanti Omkar and I have my own show at the BBC Asian Network every Sunday at 9 p.m. Welcome, welcome, welcome. This is our South Asian heterosexual well-being webinar. It's a very, very interesting place to be right now because a lot of us are wondering and dealing with the pandemic, which has been pretty tough on many people. So it's wonderful to be able to spread awareness and for us all to be a part of this session to understand better how people can be helped throughout it. Thank you for joining us tonight. Tonight's event has been commissioned by Thrive London and it's produced by the Brixton Reel Film Festival, wonderful festival. Kudos to the whole team. Thrive London have been doing an amazing job, and what they're trying to do is to find out how COVID-19 has affected a variety of specific communities in London. This includes heterosexual South Londoners. And this includes heterosexual South Asian Londoners, I should say, not just South Londoners, but across London. They've commissioned a survey to better understand our experiences. The plan today is to go through some questions in the survey and answer them together with our panelists. You can find a link to the survey in the chat, and we'd love for all of you to take part in this. Please, please, please put your questions in the chat box at any point. We will be monitoring it throughout this chat. This survey has a little bit of an added incentive also to fill this in, because there is a wonderful prize. There's a prize draw that you'll be put into the minute you've filled in the survey. It's for a hotel night and dinner for two at the Blue Orchid Hotels in central London. And throughout this webinar, there'll be questions popping up on the screen, and together we'll answer them. We want to kind of shape these stories and experiences and discuss potential ways for London councils to be better prepared to support our needs in the future. So this is a really important piece of work that is being done. To do this, we have a fantastic panel of community organizers, mental health professionals, and creatives. We've got three esteemed panelists right here: Ripon Ray, Dr. Kuljit Bogle, and Dr. Vikesh Sharma. I'm going to let the three of them tell us a little bit about themselves. Let's start with Ripon.
Hi there. Yes, can you hear me? First of all, I know there's always a problem with Zoom and hearing. Okay, yeah. So I suspect you can. So briefly, I'm coming from Ashanti. I'm coming from wealth rights and debt advice background for 7 years, 8 years. I've traveled all over London, really, and most importantly, in Newham and Thames, and giving advice to those who are genuinely struggling financially. And you could easily imagine, in times of COVID and lockdown, things have been, I don't know, worse than ever before. So as you can imagine, a lot of people have been affected by it in a number of ways, mental health and financial too. But to compensate my personal, I suppose, grievance during the period of lockdown, I ended up writing topics and subjects around COVID and how COVID had impacted Bangladeshi community in Britain, as well as very much of things. So if you really want to have a read about my work, feel free to do so. And I'm sending you my link just now, and you see there are horror stories to tell. And I'm so privileged that I've been able to capture those horror stories in time of great significant.
Thank you so much, Ripon. We look forward to hearing all your views and helping us answer all these questions that we have. Let's go to Dr. Kuljit Bogle.
Hi, good evening. Thank you for having me on. My name's Kuljit. I am a learning disability psychiatrist by background. I stopped practicing clinically about a year ago to pursue a passion in art, and now I'm going to do my master's. So my other role is that I'm a volunteer with an organisation called Taraqi, which supports better conversations about mental health in Punjabi communities. Born and brought up in West London. I've worked in London, but I'm currently living in the South. I also run a monthly support group for LGBTQ+ Londoners, which we've had to stop face-to-face during the lockdown.
Right. Sounds like you're doing some amazing work right there. Dr. Vikesh Sharma, let's go to you now.
Hi everyone, thank you for having me here tonight. I'm Vic Sharma, I'm a GP in Stockwell, South London. I am also Clinical Director for the Stockwell Primary Care Network, which means when 5 GP surgeries have come together to serve a neighbourhood, so that covers about 45,000 patients. Over the last 4 or 5 years, I've had a real interest and passion in working with communities and around health inequalities due to diversity, basically, the barriers that are set up due to cultural and linguistic issues and why people don't get access to the health that they need at the right time. Based in Stockwell, a lot of the community work I've mainly been doing is with the Portuguese-speaking and West African population, but definitely the reason I know I'm passionate about this is my own personal experiences and upbringing. You know, going to med school and learning about the sort of Western scientific thinking about health, and then going home to Ilford and growing up in an Indian community, that contrast and tension was always there in me. And that's playing out in my career now. So yeah, really look forward to this.
Wow, thank you ever so much. My parents are in Ilford, by the way, so I've had a few years living with them there. It's good to hear. Well, it's great to have you all. Just another reminder, the chat box is open. Anyone who has any questions, please fill them in. We are monitoring this and we'd love to kind of help answer these questions for you. Now, let's start with our very esteemed panel right here. Let's start with the first question, because for a lot of people, and we've already heard this, we're looking at this as so many difficulties that people have had, and it's obviously been more difficult during the pandemic and with social distancing kind of measures in lockdown. That can't have been easy. Now, what do you think has helped to kind of make this a bit more bearable, I would say, for the people that you've been working with? Let's start with Vikesh.
So speaking at it from a personal perspective, obviously as a GP, sort of the day job didn't change. I was still going in, still going to work. So I probably didn't have the same sort of level of lockdown and social distancing as others, but definitely the content of what I was doing massively changed. So I lost a lot of human contact, right? So I'm a GP, I love the relationships and the people contact, and that wasn't happening. It felt like I was working in a call center. I had a headset, I was calling people on a phone, and there was huge uncertainty about my own risk because of the PPE stuff that was going on, uncertainty about the risk I gave my family because all that stuff was coming out around ethnicity. And even though my parents weren't shielding, you know, should I be visiting them? Should they be seeing the grandkids? That sort of stuff. Uncertainty about the advice I give. It was a really weird leveler when my patients knew as much as I did because all the information was just coming out there, then and there in the media. But yet I still had to be some sort of voice of sort of authority on the matter. So I was getting called and being asked, you know, should I send my child to school? Should I go to work? Shouldn't I go to work? And I literally didn't have any different answers to what the news was telling us. So there was a lot of uncertainty in it. And I think how we coped sort of within the profession was, I think, how a lot of the community coped really. It was communication. It was actually really nice. A lot of people suddenly, which is really unheard of in our profession, we just sort of paused for a moment and just sort of stepped back and sort of checked in with each other and just said, you know, how's the person next door to me doing? Okay, we're not seeing each other, but let's make moments during the day where we just stop, go next door, see how the next person is doing. There was a lot of collaboration. So all of a sudden I was talking to other doctors or other specialists and saying, right, we just need to sort this out. Yeah, and that doesn't usually happen. Usually there's loads of red tape and all sorts of things. So it was just people just sort of saying, no, let's just get through this, let's work together, which was amazing. And yeah, you know, Zoom, WhatsApp, all the sort of communication methods as well. So yeah, so I think in a weird way, it's not much different from the rest of the community, how the medical profession sort of coped with this. Having said that, I think there was also, because it was all very new, there's also things that were flaws in that we need to watch out for. So, you know, I know just from the WhatsApp that some of the stuff that I was getting from family members, you know, there's a lot of misinformation out there, a lot of word of mouth stuff that just went out. And you saw the same thing with medics, right? We were so keen to say the right stuff. As soon as something was written in Singapore or somewhere else, it fled through all the WhatsApps in doctors. And, you know, we started saying stuff and then a week later it was something else and stuff. So there was a big learning around how you manage that as well. So yeah, positive things, but also, yeah, lots of uncertainty.
It sounds like communication is key, and technology has certainly helped us. I think this pandemic has made everything a little bit more bearable because we are in the digital age, which is absolutely fantastic. Now, Kuljit, what are your thoughts on this?
So I had an unusual year anyway, and then so I was I was a student And then suddenly my college course finished. Within days, we had to kind of pack up and go home. And there wasn't really any work that was being provided. So I was probably in a situation similar to a lot of other people who were furloughed from work, or were students who had to stop their courses. So I went into kind of that kind of social isolation. I have my other half, they're a GP, so I was still having some connection to the health world. And a lot of my friends are doctors, so it was really strange being in that kind of dual zone. And similar to Vikesh, I think information was coming out all over the place. And I think one of the anxieties I had was about my parents and their generation. How were they interpreting the information? How were they following the guidelines around staying safe? And initially it was really difficult because my parents, they just want to work all the time. So they were like, we're just going to keep going to work, it's not a big thing. And then the information's coming through, it's really serious. It's serious for South Asian people, it's serious for older people. And there was a tipping point where suddenly they realized it was really serious. And I think my dad, he works at the airport, so he requested to go home. And similarly with my mum, then she said, okay, well, you're going home now, so I'm coming home. And so it's really challenging, because I think, Vikesh, as you were saying, the information that we were getting externally in the news and everything was changing every day. Then we've got the information between our friends, and then we've got the information that is coming to the communities from all kinds of places. And it was all just conflicting with each other. So I found it really difficult to give advice. So for me, I think I went through a very anxious phase early on. I had to cut down my news intake, kind of get into a routine, keep myself busy, and then just kind of do what I think a lot of people did, which was just try and take things day to day and go into that weird kind of time zone of COVID lockdown, where you don't know what day of the week it is. You don't know how many weeks have passed. Feels like, 3 months, but it's only been 2 weeks. So, yeah.
Yeah, I can certainly relate. And I remember that the BBC did a series of instructions, just the basics, wear a mask, hand sanitizer, use hand sanitizer, don't touch your face. And these basics were put in various Asian languages. And this was really useful, because I think, a lot of parents are now on WhatsApp, and they are getting this information that's just completely off. And there was one thing that sent out saying, these are the spices you should be using, and they'll kind of, you'll be fine.
There were floods of, so it was like, so haldi, garlic, this guy had 20 cloves of garlic and he had COVID and he recovered.
Yeah.
And, despite my training, it's really difficult to know how to make a conversation with my parents about that, where I don't end up getting angry with them and saying, just look at the BBC, or just look somewhere else.
Yes. Ripon, your mic is off, but if you want to put it on and tell us your views, because you've been in the heart of the community, and you've obviously been hearing a lot of views.
I absolutely. I think definitely on the whole, I agree with every single one of you. Kuljit, Vikesh, definitely to overcome like a change that is a shock to everyone's system. And I'm sure you felt the same, and so did I. I think the first 2 weeks, believe it or not, I'm happy to use this platform as a therapy session, but I cried so many times. There were so many tears on my pillow. You won't believe it, because it's one of those things that you knew that, it changed your life in an extreme way, I guess, to be honest. So I thought it was a complete shock. But I knew that I personally could overcome, because I have that structure in place. Think about it. I'm a boxer and a manager now. So what do? I just tell people what to do on Zoom. Simple as that. If I need to write a report, I'll just write the report without seeing anyone. So I think on the whole, I was fine after the first 2 weeks, but not everyone was in my position. I've accepted that. And what was interesting, I thought, I knew I'm a campaigner. I knew I'm an activist. I know my stuff when it comes to welfare rights and all those things. Many people don't. And this is when I realized, rather than just bottling things in terms of my knowledge, why not share my knowledge in public to those who don't even know a thing? And what's interesting, actually, during the lockdown, I did do a survey. but focusing around COVID death amongst Bangladeshis. And Vikesh and others may know how difficult it would be in times of lockdown getting Bangladeshi folks out of thin air to fill in a survey, because they don't actually like filling in surveys anyway. But what was interesting is that I found out that a lot of folks are impacted by illiteracy. And how do you reach out to those folks who don't even know the basics of English language? So I end up becoming more creative. I've done also podcasts and also videos around, look man, I know Ramadan is coming, but please, 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 in terms of Ramadan, stay at home for the sake of Allah and others. Do you see? So I thought, let me try doing something to make sure the message is out there for the benefit of the community, rather than just sitting on my high horse and feeling sorry for myself and do nothing. But when it comes to like what was effective about it, I was so amazed how, I suppose, individuals, forget about volunteer sector, they're getting paid. That's fine. One way or the other, money is coming through, okay, fair enough. But it's the individual community members who are members and residents, they proactively went out there to help individuals out in the local community, to help those who are shielding. I really am proud how communities can take a proactive action while the government isn't.
So that was a very passionate, Ripon, really passionate. I love the passion coming out. Now, I think we have almost answered the next question, which is about whether you felt supported by those around you and how did this help? Now, for me, I feel like I heard that answer from the three of you. If you can just give me a one-liner on this, let's go straight to Vikesh.
A one-liner. So what I would add is that the interesting thing for me as a clinician was the different dynamic and relationship between me and the community, because we started to look vulnerable and feel vulnerable in front of them. Yeah? So we were like, we don't know what's going on. We don't have enough PPE masks, that sort of stuff. And it was great to see that relationship evolve. So, you know, community making us PPE masks. We had local like cafes or otherwise closed making us food and just dropping it over at lunchtime and stuff and things. We had all sorts of amazing, just small things. Patients, I was on the phone at the end of the consultation, they'd be like, and how are you, doctor? How's your family? You know, for the first time, this sort of humanness that was coming through, which is really, really nice. And so, yeah, I think there's something to learn from that. I think for me, as someone from the system, as a clinician, is actually the potential of the relationships we have with the community, if actually we take a few steps in showing a bit of vulnerability and sort of meeting halfway, rather than sort of asking the community to come to us always to engage. And as Ripon was saying, I think, you know, I was blown away by how community individuals stepped up and were just doing amazing things like prescription delivery, right? Like shielded patients, we didn't have the capacity within the NHS to do all the deliveries. People just calling saying, I'll deliver the prescriptions for you and stuff like that. So it was a real learning in how much energy there is. Yeah, it's just about how we can harness it, I suppose. How can we bring it together without over medicalizing, over systemizing it, because then people don't want to beat that. But yeah, it was a real eye opener for me. Sorry, longer than one line. Sorry.
How about you, Kuljit? I think you have some bursting thoughts on this.
No, just to say, so overall I felt supported, but as a student, we were very unsupported. And it was a real shock to me after going back to education after so many years, going to a local college and realizing that as soon as lockdown happened, everything stopped. And for all the 19, 20, 21-year-olds who were on the course waiting to find out what was going to happen about university, it was just a black hole of information. So, you know, for those that are worried about their futures, I was in a privileged position that I'd already had an education and a profession, but for them, they were left stranded. So
do you feel that, you know, you didn't feel supported by those around you, and you know, that's that side of things? Yeah,
definitely. The college was they did so what looked like to us a very bad job. I mean, you don't know what's going on behind the scenes in the college, because I suspect that they are worried about their intake for next year and finances, and they had to provide some services for key worker children and young people. But I think it was a weird thing of, well, we had the Zoom, we had the Google Hangouts, but that college the tutors there didn't have the time or the expertise to use it.
Yeah.
So I can imagine how there's probably, you know, there's obviously a whole generation of people who will have gone through that this year. So yeah.
Right. I was just going to remind all the audience as well, any questions, the chat box is open. Alice, who's producing this, is also watching the chat box. Now let's go to Ripon. In your case, how do you feel about the kind of general support of those around you?
I think I felt really privileged. I think my employer was very supportive. It literally was like a, you know, everyday well-being Zoom group. So if you want to talk about your stress and anxiety, I felt that that space was there for me to moan and groan and feel sorry for myself. So that actually made me feel so much better. So I think that helped a lot. With family members, constantly spoke to them. I mean, I think in a scenario like this, where it's a bit like a war, it's unusual, and it feels unusual, a bit like a war. So you have to behave unusually as well. I think that took us a while. I think on the whole, I think, you know, after a while, adjusting has helped. But yes, support network from colleagues, support network from parents, siblings, constantly being on the phone. I think, again, yes, communication and channeling that communication was essential to make sure you're not bottling things in, but actually getting it out of your system. I think that has helped. So, yeah.
So really using technology has been a big boon for both for all of us, really, I think, with this. And I guess for Vikesh, since you're customer facing, all the audience facing all the time, and then doing this behind technology was a bit of a jump for you. But you know, I'm glad that people supported you all, you know, in such a way. And Kuljit, I'm so sorry to hear that you felt so unsupported, you know, about this, because you know, what can I say? I think, you know, from my personal experience, I have to say I'm very lucky because the teams at the BBC had been fantastic. They have taken, you know, this all very seriously. I was already set up to work from home. There was certain things where, like, my husband was working in his office 9 to 5. For me, I was working from home for the last kind of 15 years. So it didn't feel like a huge change for me. The only difference was that I was putting out everything digitally, but I didn't feel that change as much as a lot of people I know did. But a lot of people have really struggled with this. And where there's been technology, I think there was this overwhelming desire for people to just spread this news without verifying it. And I think that was a pet peeve for me, because I was getting information from lots of aunties, you know, sending me stuff. Some people had to be blocked because I felt like they're just sending me stuff that I don't want to see. This is definitely not verified. And I had to keep saying to people, go to credible news sources. This is very, very, very important. Don't spread this news. And I was really blunt with everyone. I wasn't even this person who was going to be very coy about it and just allow people to send me stuff that wasn't great. I was very blunt in telling them. So it has been a process, and it has been, I think, very tough for all of us. But so many of us have been supported by partners, and I think that has been such an important thing. And having a community, I think for Vikesh, that was I think the loveliest story I've heard today, the fact that the community just all said, how are you, doctor? And I remember going to the pharmacy at the beginning of the pandemic, and I was saying to the ladies, you know, how are you guys doing? And they said, look, you're the first person to ask us this. You know, we've had some people who are coming in and they're so agitated in themselves that they're taking it out on us as well. And that seems to be something that I've been hearing a lot. Like, on one side, people are being very much more human than ever before. And on the other side, there are people who are not being so human. So it's been an interesting learning curve for all of us, as you've all been mentioning. Now, let's go to the next question, because London, we know, is an inclusive place, you know, to live, to work. Oh gosh, sorry, have I missed one question? Yes, I have. I'm so sorry. I was jumping to my favorite London question, but let's go to number 3. This is about marginalized groups. How can these experiences of marginalized groups be fed into health, mental health, and social services to be better prepared to support them in the future? What are your thoughts? Let's go to Vikesh first.
So my experience through the community work I've done is, no matter how hard I try and be holistic, community orientated, whatever, however you want to phrase it, there is an inherent bias in the way I ask questions or process the information that comes back to me, just because I'm of the system. And so I think we need to be really wary when we do these sort of experience finding, fact finding missions from communities, that we're really careful of who's asking the questions and how that information is being processed. I think actually the thing that's really worked in my experience is finding the people from within the community who can tell the stories and tell them in a way that is relevant to that community, you know, because by the time it gets to me, I chop and change it and turn it into something in a chart or a graph or something and present it at a meeting. So there's something about inherently there's an inequality there almost when in the way you create, you get that data. So what I'd love to see is almost sort of some sort of leveling of that, like different ways of collecting experiences. I think we need to think really carefully. I think this sort of stuff is great. Some of the stuff, you know, all the stuff that Brixton Reel do and stuff, you know, finding different medias, new ways of doing it. One of the coolest things I've ever heard, I know public health, there was a state in America somewhere where to decide where they were going to invest resources, they did a photo competition where they asked residents to take photos on their smartphone of places that gave them well-being. And then they ran a public exhibition and that created the conversation. And based on that, they invested public health resource and stuff. You know, and that sort of way of hearing experience, I think, is something that I'd really like to see more of.
Absolutely. I'm going to go straight to Ripon. You're keeping it all silent for us while listening to us. I love it. Ripon, what are your thoughts on this? Because you've been, again, hearing these stories straight from the horse's mouth, so to speak.
Yeah, absolutely. It's a horror story. In fact, one of the surveys I did was interesting. New before the data actually came out of the NHS. Sorry, am I still connected?
All good.
Okay. Yeah, I didn't realize the targeted group that I was targeting, Bangladeshis, were going to be like a massive group in terms of the number of Bangladeshis who are dying under COVID compared to other communities. That kind of happened by accident. And the reason I did that, because I knew on the back of my mind, if you look at any forms of government statistics, I mean, I've got it here, some of the data anyway, which shows that, you know, there are in proportion more Bangladeshis are benefit claimants, either in the context of income-based benefits or even actually disability-related benefit. So obviously, we're dealing with marginalized communities who are kind of economically one of the poorest. I knew by default from experience of campaign work that community is going to get hard hit. But the question is, how can I quantify it? How can I justify it? That survey was quite useful, actually, kind of to identify what could be done. And a lot of folks felt, especially 63% of those who can't even, let's say, read or write, and plenty more who have got less than GCSE in terms of their education level. How the hell do you reach out to them? Yes, we can think about visual effects, but think about it. And of course, Vikesh, you know that yourself, is that when you're stressed out, especially many South Asians, they won't look you in the eye or they won't see things. They will bring their eyes will be down below looking at the floor because they are feeling anxious and nervous. So I would say really in terms of learning curve, we have to go back to basics, and basics are our look at me, look at this, flash, 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 flash everywhere. But also we need to think about sound. When it comes to being a campaign in the context of COVID and be effective to avoid deaths and other things, we need to use all of the senses. I think we need to find different languages that are on the streets. In Newham, I think we got zillions of languages. We need to find ways to make sure we will reach out to them to make sure we save lives in the end. But education is crucial. We need to find ways to make sure linguistically they're being targeted so they know social distancing and keeping yourself clean is essential for their livelihood and in order for them to survive, for God's sake.
So true, so true. I think those figures when they came out of Newham, because for me, growing up in Nigeria, I moved to to Newham, to East Ham, and that community, it was just so sad when I heard what had happened, and seeing those figures and all of that. And I think you've really delved into some of those reasonings. Now, Kudit, what about you? How do you kind of feel about this? Because I mean, obviously, Asian mental health is something that is a taboo still within the community. So I'm sure when you're kind of looking at this question, you can resonate in so many ways.
Yeah, it's really tricky though, because I think going back to a point that Vikesh was making, that so to be careful not to use the language that we learn and then apply it to populations that don't use those terms. And I think for example, one thing is this idea that South Asian language don't have a word for depression, and that's a very kind of commonly said thing. But even if they don't have a word for depression, they have lots of words for sadness and stress and anxiety and difficulty. And I think there's for a long time there's been a thing within the profession that we need to teach people how to say the word depression. And by saying that, then they will then know what depression is, and then they'll come and then use the service for depression, and they'll take the treatment for depression. I think that in health, it's very easy to get disconnected from what normal people are doing in their lives. Most people aren't thinking about their health day to day unless they're sick. And they will use the examples of the people around them to inform their choices. So the story that came to mind when I saw this question was thinking about a relative of my mum's who's in her 90s, who suddenly developed like something wrong with her brain, which it looked like maybe dementia or something. She was threatening to kill the people in her house, and she's really out of character. The first thing that family group did was call my mum, and then what my mum did was to call me through my brother. They didn't call the health service, didn't call the GP, didn't call 111. And then I ended up having a dialogue with this family group, and I tried to explain it to them in the way that I understood it. And I said, you know, there are services out there for this problem. You just have to access them. And it took about 2 or 3 weeks for them for the person to get help. They ended up in hospital. They came out, and when I spoke to them then, they didn't know what the doctors had said. They started on a treatment which she was supposed to take at night. They didn't know what it was for. She was very sedated. And there are parallels for me in my learning disability work, where there's a population who can't communicate their difficulties to the people around them. And if you're not careful, if you're not curious enough, you can end up making a whole lot of assumptions about what people are experiencing, applying a whole load of solutions for those assumptions. And then it can be years down the line where you realize someone is on 10 medications when they should never have been on 1. So I think the challenge for that question is really making sure that if you can, you take the time to listen and be curious about the populations that you're thinking about. And in mental health, we have experts by experience, so people who have lived with mental illness or similar, who you bring to the table when you're talking about things like treatment pathways or you're making decisions about services. It's still not as well developed as it should be, but it's amazing how bringing an expert by experience to discussion really just changes the quality of the discussion.
Oh, that's a very, very insightful indeed. And it just kind of made me think that, you know, we have the whole idea of Navarasa, which is the 9 emotions. And we see them in music, and we see them in dance, we see them in cinema. But when it comes down to it, it hasn't kind of filtered down into the family structure, I guess. And people find it very difficult to explain that mental trauma that they're feeling. And I think, you know, for me, week 1 to week 2 of the lockdown, I had anxiety. I mean, it had skyrocketed, and I just didn't know what to do. And I think one of you mentioned how you had to kind of shut off your social media and all of that because it was just too much and overwhelming, and you're looking at R rates and you're looking at how many deaths are here and there, and it just all kind of got to me so much. And I have to say, how much more for somebody who doesn't understand all that but has just been told that there's a pandemic out there, you could die if you go out. I mean, it is a very, very scary time. But let's move on to the next question. Now we go to my favorite question about London. Alice, let's put the question up. So this is about London being an inclusive place to live and work and grow, and what sort of changes London might need. Because the minute, you know, you're not out and about in London, you really feel it. You know, there was a book called Lonely Londoners, if I'm not mistaken. And I think it's one of those cities where I personally don't even know the name of my neighbor on either side. And that just goes to show that, and I'm not a lonely person, but you know, if I wasn't always connected to different people, and if I didn't have my partner and family, I would feel very isolated. And I think that's what London is as a city in some ways. It's a city full of migrants. It's a city full of people who are going out there to work. What do they do? What can we do to support them? And people on low incomes, it can be even harder. If you can't pay for your bill to have the internet, for you to connect with someone on WhatsApp, for example, everything changes, doesn't it? So let's start with the doctor, Vikesh. Let's go to you.
Yeah, no, it's a great question. I think we've kind of touched on it already, actually, which is what we mean by inclusivity, right? So we often, it pans out, it's like, we need to get you thinking and talking like we do, and then we're inclusive. And one of the big things, again, I've learned through work I've done is actually we, like when I say we, I mean the system at large, need to be braver in actually valuing and embracing diversity and realizing that different perspectives, different ways of looking at things can actually really enrich what we're doing and create new solutions. And so a very personal example for me would be, you know, I'm used to going to lots of meetings, strategic meetings, where you've got a whole bunch of NHS type people, managers and doctors, and then you've got one or two token community representatives who happen to represent the whole of community, right? And they somehow do that service. And you always get that voice gets lost. And doing the community work, it was completely flipped. I was the only NHS guy in a room full of community liaison officers, social workers, volunteers, other individuals. And it was immensely tense for me for a while, because I'm not used to that sort of place. I was really tense about how random the conversation was and where all the different tangents it went on, you know, because as a scientist, I want to think quite linearly, like, okay, we do that, this is the outcome, we can measure it by then. And you have to embrace that, you have to go with it. And just a small example of that, so I worked on a project where we were measuring well-being within a household. So not an individual, but how well does that household feel if you got them in a room and talked about how they were getting on with each other. And you know, if I'd come up with a solution myself, it would have been dry. It would have been some sort of assessment form. You'd have had a score. Then you'd say, right, you're here, you need to get over there, and now I'm going to make you get over there. You know, that dynamic sits there. But actually what we ended up doing was, this idea came from others, was the households planted a plant in the house, which was a symbolic sort of representation of well-being in the household. And there was this physical representation of well-being that the family sort of sat around, talked about, watched it grow, nurtured it. And it really created this narrative that they owned about their own well-being. And it was amazing to watch. And, you know, moving down the line, you've got these houses now full of plants everywhere and, you know, moved on and stuff. I would never have come up with that. And we would never have come up with that as a system, because that would have been too strange or random for us. So yeah, I think inclusivity comes from actually embracing the differences rather than sort of figuring out ways of bringing people into your world, I think.
Brilliant. I mean, wow. And that's just so heartening to hear. And it's a wonderful idea. I have to admit that I bought a plant myself during this time. It was just something that we thought about and thought, oh, we should nurture something within the house, you know, and then I think that's lovely. We have a brilliant question here from Raj Puri, but I want to get through these few questions before we go to Raj. Now, let me throw this same question at you, Kudit, because you've mentioned that in terms of being in college, and a lot of students have kind of really struggled with this, and the usually inclusive London suddenly doesn't become so inclusive when you're locked down.
Yeah, I mean, the difficulty I had with this question is I'm not sure London, when you talk about inclusivity, you've got to think about, I guess, who is being included and where are they being included. Because when I think about where I grew up and where my family all still live, vast network of people, it's pretty inclusive for them. But they live in an ecosystem which is mainly around Punjabi culture in that area. And it's an ecosystem which has developed over a very long time. So one way to make it to keep it inclusive is to try and resist the pressure that London always has of money pressure and the property pressure, because I think in 10, 20 years time, maybe if COVID hadn't happened, I don't know what's going to happen in 10, 20 years time now, but there'd be a pressure for housing that would just keep moving out slowly and slowly throughout London. And my family will stop being able to afford to live there. So I think the thing for me in terms of inclusivity, I think London is so rich and diverse. This is a really difficult question to think about, because it really depends on which part of London and which micro part of London you're thinking about. I think when it comes to inclusivity, I would say if there's a way that London can still change over time, but not push out the people who are not rich. So you don't have the means to be able to choose whether they live in central London, whether they live in outer London, whether they move just outside of London and commute into London. The people who are doing the day-to-day work in the service industry and everything else.
That's a very, very good insights right there, Koji. Thank you so much. Let's go to Ripon. I know you have you're bursting also to tell us something about.
Yeah, I mean, I remember giving advice in Hamlets, and in fact in Stratford Arcade in Newham as well. I mean, when gradually some of the kind of welfare reform policies were being implemented in these boroughs, and believe it or not, what I saw was pretty much opposite to inclusivity. We're heading towards complete exclusiveness. And what I mean by that, because you are unable to afford to pay your rent for literally being poor, let's be frank, for being poor, you're told, and you can't blame the council. The council is just enforcing whatever the central government is doing, saying you can't live in the property because your benefit isn't covering your rent. So therefore, I'm afraid you're gonna have to go to a place like Colchester or Burnley or wherever it may be, because there's nothing here to accommodate you. Even if you come back to the council to say, well, I want a temporary accommodation because of blah, blah, blah. Yes, but even then, if we have to accommodate you, it's not going to be in Newham. It's not going to be in Tower Hamlets, because it's definitely not going to be in Hackney either, because that's where I live. But it's partly because price of properties have rocketed high and the income isn't covering to pay for your rent, let alone for your kids. So therefore, the only one-way ticket for those who don't have the means, I'm afraid the data itself will show you ethnic minorities are pretty much on the bottom of the food chain when it comes to in Britain. So therefore you're out of London, and therefore it's no longer about inclusiveness that we talk about. We talk about financial exclusiveness. So hence I remember growing up in East End, where literally it's, if you had peanuts, you're fine. But now that is not the case. Stratford has become so gentrified, and you feel like you have to be so salubrious just by being in Stratford around the Olympic parks and stuff. Normal folks can afford to pay for those kind of flats. So really, to make it inclusive, we have to talk about proportionality, i.e., do we only want rich folks and who have high earnings, or do we really want variety? To me, inclusivity means both in terms of means and culture. And the way things are going right now, we're seeing complete exclusiveness.
Wow, that's
it's sad, but it's true. And like COVID will bring worse. Apparently, like already 2.5 million people are signed up for universal credit in the last couple of months. Let's see how it goes once the furlough thing comes to an end.
Yeah, gosh, it's there's so much for us to kind of unpack with this whole situation. Let's go to the next question, Alice. So what do we not have in place to listen to these stories and these experiences of Londoners? Because Londoners are tweeting, they're on Instagram, they're on Facebook. People are putting out their views. But what do you think is not in place to help develop and support around these needs? Let's start. Sorry, I was going to say let us start with Vikesh for this.
So. You're absolutely right. There's really strong voices within communities and really proactive people. I think my experience has been that they still don't feel like they have permission to sort of break from that community and actually speak to the wider system. So a lot of the work I do is trying to identify those people within communities. So I've moved very much from clinician trying to sort out health inequalities to basically being an advocate, finding the people within communities who actually have that passion and are those voices, but have never felt entitled or have the permission to do it beyond the spectrum of their community. And you know, I can, again, very mildly personally relate to that, right? So I'm first guy who went to university in my family, grew up in Ilford. Looking back, unintended or implicit in your life experiences that form you, you're learning your place in society, or what you have access to, or where you should stand, right? And that's due to the socioeconomic standing, to your race, whatever, right? And then I go into somewhere like medical school, where it's all about tradition, hierarchy, a banter, a way of doing things and stuff. And instantly you feel like there's other people well suited or better suited than you to that environment. So it takes you time to realize that, no, actually my voice is just as valid, or I'm just as entitled to be part of this crowd. And so that's a very mild, you know, I've been very privileged in my upbringing, but, you know, I can see that writ large across the communities I work with. You know, I'm working with families, low skill, low education background, second generation kids in Stockwell who are born and brought up here, speak English, but they think that the only life that they can have is what their parents have, which is, you know, domestic workers, shift workers, stuff like that. The aspiration isn't there. The role models aren't there. They're infused in a way of thinking that means that they don't have that feeling of that they're allowed to. They have that permission. So yes, they'll be strong on their WhatsApps and their social media within the community, but I think we need to sort of break free from that a little bit and actually get them feeling empowered to talk to everyone, I think.
How about you, Kurjit? What are your thoughts on this?
I think I had an answer for this, but then listening to Vikesh's answer, that's better. Because I think there is something, and I've seen it time and time again in my clinical practice and in other places too. I think empowering the disempowered, which is much harder than it looks on paper, it isn't just a case of bringing someone to an environment and say, well, now you're here, you can speak. It's about trying to instill a level of self-esteem and self-worth, which someone might have in their local community, in their networks of you know, that they're in day to day, but trying to say to them, look, we're all in this together. Your story is important. Tell us. I think that kind of genuine curiosity goes a very, very long way. I think the other thing, which is the challenge which we talked about earlier in London, is the same challenge everywhere really, which is there's so much information about everything all the time. So I think that whenever there's an intervention which is planned, or a change that's planned, I think people need to think carefully about, as well as bringing people in, supporting them to work out how do you then share that back with your community, because then that will ripple out into different spaces. So I think, yeah, empowering those people, because all the stories are there. We just need to
tap them out. We just need to, and the man who's been tapping them out has been Ripon for that one community. Any thoughts?
Yes, the answer to this is simple. Ask. That is it. Our communities, it doesn't matter if it's Pakistani, it doesn't matter if it's Indian, it doesn't matter whatever. We can say we want the stories. But how the hell are you going to get the stories if you don't ask for the stories? And you realize the moment you ask, you'll be flooded with stories, and just like I have. But the thing is, to ask for those stories, you have to ask in their language, and to ask in their manner, and to find out what position they're in mentally. To do that, you need a number of things. You need knowledge of a community. You also need resource to tap into that community. And the way things are going, as time went on, resources have been eradicated and removed, that now communities are so fragmented than ever before that they've forgotten how to tell their stories. And that is why we have one community here, one community over there. And plus in London, Ashanti, you mentioned yourself, you don't even know your own neighbours, for God's sake. Your neighbour might be here for like 6 months, and there we go, tenancy has come to an end, and here comes another one. So fluidity, it's so fast that it's impossible to build that strong relationship in times of, I don't know, flexible labor market and flexible communities. However, if you really, really want to know, the only thing to do is take a deep breath and ask, and get that person to ask. So at least the person's story can be relatable. And currently, as it stands, we are far removed from the person that we're talking about and the person who's meant to be going to ask. And there isn't enough resource to do that at all. Vikesh, I'm sure in one way yourself, you know, you work in the NHS. As time went on, cuts are happening left, right, and center. I mean, cultures, you'll also know in the mental health, bloody hell. I mean, we've been crying out for mental health support for so many years. As time passed by, it reduced even more. So now we really need to think within ourselves, what kind of society do we really want? Do we want a society that genuinely cares by just kind of plastering when you feel like it, realize that, okay, we haven't actually done the job properly, but systematically we need to think about investment for the well-being of those who are left behind?
Very, very good thoughts there, Ripon. Thank you so much for that. Now let's go to question 6. It'll pop up on your screen. Anyone who wants to ask some questions, the chat bar is open. What do we not have in place which would help all Londoners develop confidence in social and mental health support services? Now, this is quite a loaded, tough question. Ripon's smiling there because you kind of answered this a little bit, but let's go straight to the doctor first, Dr. Vikesh.
So I think Kourjit kind of stole my thunder a little bit with this answer in one of the earlier answers, actually. To me, it all comes down to, we're obsessed with, oh, how do we get them access to this service, right? And we're just looking at that, whereas actually we don't, it's about how they talk about how they're feeling, right? It's about, comes down to language again, and understanding what mental health means to someone in that culture and in that context. And until you don't start having those conversations in a really open and honest and frank way, and as Ripon said, in a way that, in a language that they understand, then, you know, they're not gonna even go to that next step, right? I need to go to this place or that place. And so yeah, so my experience, you know, even pre-COVID, so one of the things that really struck me was when I worked with communities, migrant communities who are low skill, low education, where they've come to the UK for a better life, right? It's been a need, there's been a drive there, but there's been a massive sense of loss as well. They've left their home country, left connections, you know, it isn't a choice that was made easy. And actually, what was really amazing for me to understand, and this is what I mean by learning stuff in other communities and reflecting back to what I saw in Ilford, was it's almost like a kind of bereavement or a kind of sort of trauma that whole communities have, where they've lost these connections. But it fits into like a narrative of a struggle, like, you know, this is our life. We're here to make ends meet, keep on going. I'm not sleeping well. I don't eat properly. You know, I don't really have any forward ambition beyond my next day. You know, all these things, if I step back clinically and sort of tick boxes, I'm like, you're suffering from depression. But to them, it's so entrenched and so normalized in their day-to-day that to suddenly go to someone and say, you have depression, there's a depression health service down the road, you know, it's not relevant. It doesn't feel like something that they would think about or do. So until you start talking about things in a way that is relevant and meaningful to people, right? They're not going to look for services. They're not going to access services, and I think that's a big thing for me.
So we're in a slight kind of race against time at the moment. Thank you so much, Dr. Vikesh. Let's go to Kourjit for a quick answer to this one, because I think we have kind of covered this a little bit, and Kourjit had hit the nail on the head.
Just as a quick addition to that, so I think we haven't really grappled with supporting migrants to relax into the country. So even established migrants, they are still doing that fighting for survival situation. So they're not going to seek help from the doctor because they just need to work and earn money, because when they arrived here, it was a very scary place. For some, it was a very racist place. For some, it still is a very racist place. They just need to keep their heads down and work. So if someone says to them, oh, you need 2 weeks off because you're not sleeping properly, they're going to, why would I want to do that? So I think fear about where people have come from, what this country is and what it means for them or meant for them, and also trust do I trust the white doctor in the GP surgery who knows nothing about my background, who doesn't ask, who's not curious about my background, or who's assuming about my background? Or do I just tell them the bare minimum, say yes, take the tablets home, put them in a drawer, and then keep collecting my repeat prescription every month, and filing them away in the drawer, you know, and not taking them? And that's definitely, I've seen that happen multiple times, you know, and they just don't want to upset the doctor. They don't have to have a conversation with the doctor about, I don't think I need this, or I don't think I need to, you know, this may be wrong, or it's not suiting me. So there's all kinds of things wrapped up in there. But I think that point about trauma related to migration is something that really, really needs to become more part of a usual conversation, or a check within someone's initial consultation with someone.
True. I've got to say that as like, I have had a lot of health issues, endometriosis, etc. And one of those difficult things is that you don't get, back in the day, I think you'd have a pediatrician who stayed with you all your life. And then when you grew up, there was still the person who knew your history and could help you. Now the doctor surgeries change all the time. There's staff attrition, and there are so many issues. And speaking about mental health to even a GP can be a daunting task for the best of us, for people who are even very switched on about mental health, going up to that GP and saying, actually, I'm feeling like my mental health is not okay. And the GP at that point is also very, very busy, and they can refer you to a support service, but that support service is very overwhelmed and already very busy. So there is a lack of structure, I suppose, all across that. And I personally have felt that I had not been listened to by various doctors over the years, and I had I ended up having a stage 4 endometriosis and a hysterectomy, because for like 20 years I had various doctors who just didn't get me. And there was an article in the Independent actually about a lot of Black, Asian minorities who felt that their doctors just weren't listening to them, and that they weren't being taken as seriously as their white counterpart or their white friends in a support group. So there are lots of layers to this discussion, and I guess the mental health side of things is very, very important. And I think that getting Asian communities to open up about it is key. Ripon, what would you like to tell us about this? Very quick answer.
That is, no, absolutely quick. I think I covered the other one. You're right. I mean, we do like to see people of our own. Believe it or not, we respond effectively, unless you're brought up in a space where you're kind of used to seeing people of different faces, fine. But for most folks, I think we do, in order for us to feel confident about ourselves, we need to see people like ourselves on the other side. And then we do open up, and the way things are going, we're not seeing enough of it. And we are talking about mental health as we're doing now. I mean, how can you relate to cultural aspects of things and press that right button if you're not coming from it? Of course, you can do a generic session where you can talk, you can unfold the problems and all that jazz that all mental health practitioners have to do. But we do have to see our folks, our shades of color, in order for us to open ourselves out. The way things are going, I'm afraid resource isn't being invested adequately enough to reflect just that. Good on you for those individuals who are progressing, great. I'm sure it has been a struggle, and it shows that you have survived and you are one of the survival of the fittest, but on return, you realize that there are many who are left behind.
This is an unfortunate truth. Let's go to question 7. So in your experiences, which are the services that people are confident to use, the services that are already out there? Because I have to admit, like at the beginning of the pandemic, I had, I didn't have COVID-19 evidently, but I had something that resembled it because I was coughing and the bad throat and all of those things. And I was very confident to call my GP, though the surgery was closed, we were on lockdown. I called my GP because I had a confidence to do that, and they prescribed me an antibiotic. I was able to walk to the pharmacy down the road. Like I was very, I have to say I felt very lucky to be in a place that allowed me to do all this very quickly. And within hours of me calling the GP, I was taking an antibiotic, and I felt very confident doing that. But there are so many people that wouldn't be. They wouldn't be confident to even pick up that phone and make that phone call. Vikesh, what's your experience with this?
So from my understanding, sort of the work I've done, I think if anything, communities will look for entries into the system which are familiar or they can sort of relate to from back home. So family medicine clinics, GPs, whatever you want to call them, they have a sense of that. So they'll go there maybe. Pharmacists actually is another one that they might reach out to. But A&E is the other, because hospital is always a hospital wherever you come from, so you'll go there, right? But everything else that the NHS sets up and tries to offer pretty much is not on communities' radars. So 111, out of hours GPs, different other crisis services, all of that stuff and things. And so if your GP is full or got a huge waiting list, or if A&E is turning you away, then what you do is then you start resorting to community answers. So then you sort of fill that void with word of mouth, media, like cable TV and all the information that's coming through cable TV, massive influence on people's health behavior and what they're deciding to do and stuff. All these private clinics, some are good, some are bad, but you know, people from the community set up private clinics that sort of mimic what was going on back home, so that they feel comfortable and familiar to go there and talk to them and stuff like that. But they're often unregulated. As I said, some of them are amazing, but also you see some really sort of dodgy stories coming from some of them where things were not done appropriately. So yeah, I think it's I think there's a lot going on. I think there's something about how, so as a GP, I'm really interested in how I can engage with the media and the outlets that the community trust. So I've done a lot of work, for example, with the Portuguese speaking, with the local Portuguese newspapers, with getting onto their Portugal cable TV, that sort of stuff and things, where the message is coming out in a slightly different way and in a way that they trust.
Wow. Yeah. I mean, I think it's lovely that you're such a conscientious, you know, GP who really has been making this effort during this time, and your duty as a doctor has obviously taken precedence, and I absolutely love that. Now let's go to Ripon, because he's smiling there. What do you like to tell us about this?
Well, I mean, in terms of, I mean, it's one of those things, isn't it? Let's be honest about it. All of us over here, we've nailed the basics. We can easily go and research and Google and all that stuff. So we know how to solve our problems. NHS Direct online gives you all the information about all those things. So really, we are fine. So to answer the questions, I'm fine about all the things when it comes to looking after myself. But so the question is, how those who can't look after, what can we do for them? Although the question isn't really about that. Do you know what? The last interview I did was of a young girl who's 11-year-old, and the link is over there on YouTube video. And when I was talking to her about her situation during lockdown, as she was unfolding herself, I realized she herself needs mental health therapy, because she lost her friends when she used to go to schools and see those friends. And now, since the lockdown, she was stuck at home, just staring at her brother who can't stand and do basic stuff. It was such a shock to her. So I think we do really need to think about investment, not just simply of adults, how kids are being affected by it, and kids are being neglected through and through. But for me, believe me, all the services are fine, because I'm quite attuned to things when it comes to services. In fact, I myself am a service provider. So yeah, I'm kind of well equipped, but I know there are plenty who are not, and we just need to think about them a lot more.
So it's really about how to communicate to people about what the services are out there. And I guess that's something that maybe isn't happening well enough. And perhaps it just means that the Asian media also need to kind of pick up on this so that they can communicate where people can reach out for help, because I guess it is there. Some of it is about where to find it. And
yeah, absolutely. I think in terms of informing, we have to spread it. I think the funding level needs to be throughout to make sure it's done properly, smoothly. All the Asian channels and other channels need to be bombarding the information that is essential in the language that we speak. Currently, it's not happening, but a few pockets who are doing it, but more needs doing.
More needs doing, because the truth is that there's this fantastic scheme that's allowed a lot of people to broadcast. You know, it's allowing people grants so they can broadcast to their communities. They're helping community radio stations. So there are things that are going on, but I suppose the pandemic grabbed us all by surprise. We weren't ready for it, and now we're trying to fix that gap very quickly. Let's go to the next question. Okay, so this is about challenging leaders. You know, what do we need to challenge leaders with to ensure there's a greater inclusion for those who experience health disparities? This it's quite an important question to answer, but we also are running out of time. So quick answers. Let's start with Kuljit.
I would say spend some time understanding your own privileges and the way that you might come across within the community that you are approaching.
Excellent answer. Excellent answer. How about you, Ripon?
You will hate me, Ashanti. I know you will, but I'll be courageous and daring. We have to genuinely think about proportional representation. I think it's fine from top down, the way things are going, it is top down. It has been top down. If we are saying we want to see true equality, we need to think about proportionality. Literally 50% of the population in London are ethnic minorities, and those mainstream jobs, we're not seeing it, I'm afraid. We've got a long way to go. Like I said before, we do like our own kind in order for us to heal ourselves. We're miles away, I'm afraid. More needs doing. And the way things are going, it's declining, but we really need to work hard to make sure proportionality is there. Along with that, so is funding.
Good answer. I love the passion. How about you, Dr. Vikesh?
Yeah, I mean, so it's about training. So it's about how you develop the next generation of leaders, so that they are comfortable to make those spaces, embrace diversity, look at how they set recruitment, project milestones, all of those things. But it comes down to training.
Wow, yes, I guess education is the key to all of this. And we've been hearing this from all three of you, that people are needing to be educated, but they're not necessarily getting the information in the right languages, I suppose, or in something they can relate to. And I think that seems to be a recurring theme here, and I think it's very important. Now, I would just like to remind everyone that you can put any questions you have in the chat box. We are monitoring this, and we would love to have our expert panel answer these for you. Let's go to the next question, Liche. Right, now this question, I mean, when I actually had read this, Hakeem had sent this to me, and I was very, very intrigued by this, because we are all very dependent on media. We're very dependent on the news. And what kind of news headline, what would you like to see in a year's time? Something citywide or something that's specific to you and your community? How would you like things to have changed by then? And what would be the ideal scenario for you, if you were to give it in one headline? Let's go with Kuljit first.
Oh no, I struggled with this. So I thought something like, I don't know, Southall mental health team co-develops new dementia service with local Punjabi population. Something like that.
Brilliant, I love it, I love it. How about you, Ripon? Oh, you've got to put your volume on.
So I kind of answered it in a weird kind of way. I didn't actually realize it was a year's time. I had my head kind of around COVID still, probably because I'm kind of immersing myself in that kind of setting. So in that setting, the statement that I said to myself, and it's really weird actually, and that statement I stole from a doctor. So yeah, a doctor who spent time in Leicester during lockdown, and he was talking to his dad on the phone and preventing his dad to go out. So, and the dad is very simple, and he liked his routine. He's old folk. How dare you tell me what to do? You know, I've got my own routine, and I love my routine. How dare you, you kid? But of course, with a simple man, I realized you have to deal with it simply. Though academic stuff just won't do. It's just won't do. So although it might be wrong, but I'll just say it. But also, please feel free to kind of make it polished as well. Is if you die, Dad, your children won't be able to cremate you, because if you die of COVID, your children won't be able to cremate you. Because, tell me, Vikesh, if I'm wrong, but of course, there are exceptions and rules, but usually when you've got COVID and stuff and you die, usually, family members aren't allowed to see them or touch them. Obviously, you can understand why. So using emotive things that are powerful to make sure the message is there in a simple kind of way, that is what I'm seeking, basically.
Wow, yes, and when you've just said it like that, I know the amount of people who were pouring their hearts out on social media when, they just couldn't be with their grandmother or father or mother.
Absolutely. So it's something. Make it simple to make sure it hits on the heart of the issue, rather than kind of making it all long-winded.
And to be honest, a year down the line, we just don't know. At the moment, things are getting better, they're getting worse. So we don't really know what will happen a year down the line. So Dr. Vikesh, what would you have to say as a headline you'd like to see a year down the line?
So I'm obviously not a journalist. I couldn't think of a snappy one-liner, but it would be something which captures the essence of something like old values reborn in a modern world. Because I think a lot of what's happened during COVID has been just becoming a bit more human again. The connection, the collaboration, checking in with each other, a sense of neighborhood, all of those things that just show that when things are really, really tough, what we resort to as sort of our primal way of thinking and feeling. The risk is as we eke back into normality, we start to forget those things again. So what I'd love to see in a year is actually ways of working that hold on to these things.
Wow, that is a good one. Thank you so much, Doctor. Let's go to question 10. I will ask the question. Do you think it is possible to build back better and fairer? So to build back and then to make it better and fairer for everyone, because we've been hearing about this big disparity and about a lot of people who just, the world has not been fair to them. What would you like to say about that one, Kuljit? Because we've heard, for many students this year, it's been a very unfair year. And, some of those students who are more privileged seem to have had a better ride of it generally. And that seems to be the case all around anyway. But even for a system like that, where we have in this country, a very fair system when it comes to education, but even then, when it came to university entries and how the whole A-level thing happened, what we found was that there were lots of students who were very deserving, who had the grades, but their place in university was given to somebody else, and they now don't know what their future is going to be. So, Kuljit, what would you like to say about that?
Well, I am an optimist, so I think that we can build back better and fairer. And I think it's a very hard time at the moment, but it's also a very interesting time. I think the fact that we can talk about race inequality, inequalities due to all kinds of things, those debates are in the media at the moment. People are asking questions. We're having conversations like this. These conversations are happening in other institutions, so medical settings, other things like that. I think in the future, we're going to be able to have a much more easy way of communicating some of these inequalities, and hopefully we'll also develop the solutions around them as well. So I think we can, and we must really, because to go backwards would be worse.
Yeah, that's a very nice and positive way to look at it, and I really hope that will be the case. What do you think, Vikesh?
Yeah, similar school of optimism. If not now, when? Right? Like people have said, with finance and housing, the cards are stacked so much against groups and communities and minorities and stuff. If not during a pandemic, when everything's sort of mixed up and churned and people are willing to listen and think differently, then when else are you going to try and affect some change?
Brilliant. And how about you, Ripin?
Only if there is a will to do it. I think, government has to take a proactive steps, and I don't think I'm seeing that yet. We need to think about a scale that is pretty much post Second World War, where Attlee's government was able to set up the National Health Service, set up all other services that we know today. The infrastructure was built post Second World War. If we don't see a national planning on that scale, but instead we are seeing it on a kind of botched basis, I'm afraid we still got a long way to go. But if there is a will, yes, but currently I'm not seeing that will that I would like.
Wow. Yeah, I hope that we will have a positive way. And then a survey like this, I think, is really important because it helps those decision makers look at how to build this positively. And I'd like to think that that will be the case. Just to say a big thank you to everyone who's on here. Any questions, we have the chat box open. Also, a message that's come through from Raj Puri. Thanks, Raj Puri, for this. Raj Puri has been involved in developing an international survey on how people are responding to COVID-19. And they want people from UK Asian groups to kind of complete this. And we do find this, we find that as Asians, a lot of people are afraid to speak up. They don't want to do surveys. They don't want to go and talk about mental health. There are lots of taboos that they're too frightened to go with. And one of his questions actually is this very good question from Raj about why do you think this is? And I think we've kind of answered that in this discussion. But the survey link is certainly there in chat. So anyone who's here, please fill it in because it's definitely going to be helpful. And I guess getting your voice heard is not just about being on Twitter, but it's also about, it's also about filling in things like these surveys, because this then feeds in to a decision maker or to a politician or somebody who can help make change. Do any of you on the panel have anything to say about it? Raise your hand if you do. Kuljit.
So I took part in the Taraqi survey over the lockdown. So that was surveying Punjabi communities in the UK and internationally. And they had very good uptake in both, I think it was mainly UK, Canada and America. And I think for them, it was that they had a trusted platform on social media and they were able to reach out to it at the time of the lockdown. So I think some of this is about the way the information gets funneled down into the communities. I think their sample probably was more like young people. So that I think there's always that thing of what are older people doing? How do we engage them? But it goes back to what we were talking about before about trying to meet them where they are, rather than trying to get them to come to us.
And with this, I think Ripon has said this a few times as well, that the older generation, they want to see somebody who looks a bit more like them because they'll feel seen and feel heard. And I guess this whole thing of representation matters is such an important thing, and representation is still lacking everywhere. And I think that's one of those things that needs to be addressed. Now, in terms of a piece of advice, like what would you like to give to people who are on this chat and for the future? I guess Dr. Vikesh probably has maybe 3 things that you think that you'd like to give as a piece of advice.
So I would say, actually, it's going back to the other question about whether we can build back better and fairer. I think for people out there who are passionate, who feel energized that they want to contribute or do something different, I definitely, this is the time to sort of make some noise and see who's listening locally. Because as I said, speaking from a system perspective, there's so much churn and so much self-questioning going on within the system right now that actually people are more open to being approached. So as simple as if you know a local GP or someone that you want to talk to and just say, look, I represent this community and I want to see how I can represent them better to the system. Something you might not be aware of. So, I said I'm part of a network of GPs. So this has happened all across the country now, these networks of GPs, and each network has appointed something called a social prescriber. So this is someone whose job it is to link the healthcare system with the local community and the local services. So every network has one. You'll have one in East London, West London, everywhere, in each of your neighbourhoods. Find out who that is. Talk to them. They're not a clinician. They're there to actually advocate on your behalf. And as I said, I know as a GP in the system, a lot of thought is going around, targets. So we're going to be told that we have to hit targets around health inequalities over the next year or two because of all the publications that are coming out. So we are thinking about how to do this right now. So if people are coming to us, like we've said during COVID, how the community and the NHS have come together to co-develop, to join relation, this is the time to come and say, I can help you with that. I can show you how to deal with these inequalities. People might listen actually right now.
Amazing, amazing. I have to say that the access to a lot of people who otherwise would be traveling all over, now they're quite stationary and they're at home. They have probably, they're saving 2-3 hours a day, and they probably will be listening to you. And I think there's a genuine need for people to understand each other better now more than ever. So it's definitely an important time. Kuljit, anything you'd like to say in terms of advice?
I'd say be aware of assumptions, and assumptions work between brown people to brown people as well. So if you, so I think sometimes people can be inhibited, so they can not want to talk if they're around someone who looks like them. So I think the training aspect is important across the board, whatever your skin color, whatever your race, everyone should be trained in being culturally competent. So having some awareness of what might be going on, but not applying it all in every situation. So I think that's one thing. The other thing is just be curious, and don't go in with a solution before you've taken enough time to understand why the person is there in front of you. It's very easy to go in and say, okay, I can look at you, you've talked for about a couple of minutes, I can work out what to do. Wait, think, reflect, and question yourself as to whether you've got it wrong, which we don't do enough.
Amazing, amazing. That's a really good one. And before I do my thank yous and remind everyone, of course, to do the survey, which is in the chat box. Ripon, what would you like to say?
Simple 3 things. Yes, definitely. First thing is first. In times of extreme period, you're not alone. So we have to accept the fact that we are not alone. We are all suffering in one way or another, although some may be suffering in extreme ways than others. That's one thing. So accept that you're not alone. And the other thing is, the moment we start seeing from the lens of those most vulnerable and start addressing those issues, we realize that you may end up actually solving the problems of the nation. Because the moment you have less poverty, the moment you have less disadvantaged communities, you realize you won't have major illnesses that we come across, because you yourself know poverty creates so many illnesses. And the moment that disappears, you realize you'll wither away so many different aspects of illness. In fact, if you already have existing conditions, you know, once you go to the intensive unit, it might not be possible for you to come back out of it. So that's why the moment we eradicate poverty, we know we've eradicated a number of other health problems.
Wow, thank you so much. Thanks so much to the panel, Ripon, Ray, Kuljit Bogle, and Dr. Vikesh Sharma. It's been fantastic. And Ripon has put some amazing links to some of the work he's been doing, and you know, the team from the Brixton Reel Festival. I have to say huge thanks to everyone there. Kari Rajinder Soni, Elise Mastrini, and Hakeem Kazim. It's been fantastic. The panelists, thank you so much. I have learned so much from being here with you all. And thank you all for joining us. It's been a very insightful session. And I hope that this really helps Thrive London to build and help. And I think we've come up with some great solutions, though we've come up with questions and we've come up with some of the negatives here. We have come up with some great solutions. The fact that the help is out there, and it's about getting that access to people. And I think that is a very, very important thing for everyone to understand, is to be able to convey to the people around them who might not be seeking that help, to say, actually, the help is out there. Let's try and help you find the person who can give you that help. And I think that is a very, 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 very important thing. The chat box does have lots of amazing stuff on it, so please all visit that. And just a quick reminder, you can win, you'll be entered into a prize draw. You can win a hotel night and dinner for 2 at Blue Orchid Hotels in Central London. I've personally been to one of of these, and they're very nice. So I'm sure it's worth trying out for. The survey is right here in the chat box that Liche has put up. So do kind of fill that in. And thank you all very much. We will all hopefully see changes, and let's hope these positive headlines and some good news happens 1 year down the line from today. Thank you.